there, this is the patient assessment medical skill. Our scenario today is a 62-year-old male who's called 911 for some chest discomfort. First, I want to make sure that I have on my standard precautions and the scene is safe. I appear to have one patient. It appears to be a medical patient. I will consider additional resources, and I will also consider SMR throughout the entire call. Approaching my patient, I'm getting initial impression of the patient. I see an elderly male sitting up in a chair in his living room. His eyes open spontaneously. He's holding his chest. I'll make him an unstable patient at this time. I'm looking for any life threats. I don't see any obvious life threats I need to treat right now. I introduce myself. Hi, my name is John. I'm an EMT here to help you. What's your name? And he says, it's Bob. Bob, where are you right now? I'm at my house. And what day of the week is it? It's Wednesday. And Bob, why did you call us today? And he says he has chest discomfort. Turn to the TA. This is Bob. He's A&O times 3, and his chief complaint today is chest discomfort. Next, I want to check his airway. He's talking in full sentences, so I'm assuming that it's patent. I'm checking rate and tidal volume of his breathing. It seems labored but effective. And his pulse oximetry on room air is 91%, so I'm going to put him on 2 liters via nasal cannula, which he accepts. Next, what I want to do is I want to check circulation, so I'm looking for any kind of life-threatening bleeding. I don't see any obvious bleeding anywhere. Checking a radial pulse. It's present, it's strong, and it's irregular. And skins are pale, cool, and moist. So based on the patient's presentation, I'm going to make him a priority patient and transport as quickly as I can off scene. In the meantime, I'm going to assess his chief complaint. So, sir, what were you doing when this started? And he says that he was watching TV in his living room, and it came on, this discomfort came on slowly. He describes the discomfort as a heaviness in the center of his chest. It's non-radiating. It does not change in any way with palpation or movement or anything like that. He calls it a 10 out of 10 scale, and it's been going on about an hour or so. You have any allergies to medications? He says, yes, I have allergies to penicillin. Do you take any medications on a regular basis? And he says, yes, I actually take metformin for my diabetes. I take medications for hypertension. I take 1 aspirin every day, and I also have nitroglycerin, which I use occasionally. When was the last thing you ate or drank? And he says he had pancakes and coffee for breakfast. He also says that he's had a heart attack before, and today the sensation in his chest kind of feels similar to his previous heart attack. So I know that what you're feeling today you kind of associate with a previous cardiac problem, but could anything else have caused it today? Have you fallen today? Have you been in a car accident recently? He denies any kind of trauma associated with this discomfort. It appears to be possibly cardiac related. A couple clarifying questions. Sir, are you nauseated? He says, no. Are you short of breath? And he says, yes, I am short of breath with this condition. So at this point, sir, can I lift up your shirt and look at your chest? So he gives me permission. Lift up his shirt. I'm looking for any signs of trauma, any scars from previous surgeries, implantable devices, accessory muscle use on this. I will get my lung sounds, so 2nd, 3rd intercostal, 4th or 5th, and then of course subscapular. What I hear clear lung sounds with some crackles in the bases. Also, I can then stress his chest, take a deep breath, sir, in and out, and to see whether or not that changes with palpation or inspiration, which it doesn't. The pain remains the same. Next, I want to get a full set of vital signs. So 160 over 90 is my blood pressure. 72 strong and irregular is my radial pulse. He's breathing 22 labored but effective. Saturations have actually come up to 95% on the 2 liters, which is kind of really nice. Skins remain the same. So my field impression is an elderly male who has a cardiac history, who's probably having a cardiac event today. I'm going to treat him with his medications based on medical direction and standing order. These are your medications here, sir. So this is your aspirin. So this is aspirin. It's the correct medication for your condition. It's your medication, obviously. It's not expired. You take 1 baby aspirin a day, so 81 milligrams a day. That's the dose, and it's given orally. They chew and swallow it. The only contraindication is allergies to the medication. Sir, are you allergic to this? And he says no. Triple check with my partner. So I'm going to give you one baby aspirin. You're going to chew and swallow it, tap one out. He's going to put it in his own hand and chew and swallow it. He does that for me. So that's been done. While he's chewing it up, I'm going to now check. This is your nitroglycerin, the correct, sir. So I have nitroglycerin. It's his medication. It's the correct medication for his condition, the cardiac-related condition. It's not expired. It appears to be 0.4 milligrams, and it's given sublingually. Again, my partner checked that for me on triple check. Also, sorry, I have to ask some questions. Are you on medications called Viagra, Cialis, or Levitra? Have you had them in the last 48 hours? And he says no. Do you take medications called Flolan, Rivatia, or Velitri? He says no, I've never heard of those, so he hasn't taken those. Blood pressure is above 100 systolic. Heart rate's between 50 and 100. There's no contraindications for this medication. Have you taken any of these before I arrived today? He says, no, I have not taken any of these. So I can assist with up to 3 separate doses. So first dose here, I'm going to tap one of these out. I'm going to put under your tongue, and he puts that under his tongue. Don't chew and don't swallow it. At this point now, I'm going to load him up into the ambulance. I'm going to be en route to the hospital, and I'm going to reassess my patient. First, I'm going to reassess his primary assessment. ABC's LOC and Glasgow Coma Scale. Nothing's changed. He's still learning-oriented ×3. Recheck my vital signs at least every 5 minutes. Updated blood pressure is 140 by palpation. Heart rate 72, strong and regular. Breathing still labored, about 22, but effective. Saturations have still 95% on the oxygen. Skins are now pink, warm, and dry. Redo my secondary assessment, looking for anything I might have missed possibly in my previous assessment, and recheck my interventions. Oxygen is still flowing. It's obviously still working well with the increased O2 saturation. Sir, I know your discomfort was 10 out of 10 previously. After this dose of medication, has it changed at all? I said, yes, it's gone down to a 6 with that medication. And then, of course, I'm going to be getting at the hospital, and then I'm going to give a turnover to the nurse. So, nurse, this is Bob. He's 62 years old. He says he was sitting watching TV, and he had a gradual onset of chest discomfort, called it a 10 out of 10 scale, non-radiating. And he's had this before. He's had previous heart attacks. This kind of feels similar to his previous events. We found the patient sitting up in a chair. He's fully oriented, ×3. And his blood pressure was 160 over 90. His heart rate was 72, strong and irregular. Pulse ox was 91% on room air. We gave him 2 liters via nasal cannula, brought that up to 95% with the oxygen. Skins were pale, cool, and moist initially. Patient says he has type 2 diabetes, hypertension, and he has the heart condition. We provided him with 81 milligrams of baby aspirin orally. We also helped him with his nitroglycerin. We gave him 0.4 milligrams sublingually. After that dose of medication, he says pain went from a 10 to a 6. He feels a little better. He's also breathing a little better as well. Updated blood pressure is 140 by palpation. Heart rate 72, strong and regular. He's breathing about 22 times a minute. Still labored, but effective. Saturations remain 95% on the oxygen.